Interpretation Masterclass, a physician's perspective information session. If you've ever found yourself looking at a chest X-ray and second-guessing your interpretation, you're not Welcome to the Chest X-ray Interpretation Masterclass, a physician's perspective information session. If you've ever found yourself looking at a chest X-ray and second-guessing your interpretation, you're not alone. Despite being one of the most commonly ordered imaging studies, many clinicians lack confidence in reading them. This session is designed to give you a structured, practical approach to chest X-ray interpretation, from assessing image quality to systematically reviewing PA and lateral views and identifying key pathologies like airspace disease, interstitial patterns, bronchiectasis, cardiac failure, and pleural disease. Let's explore how you can sharpen your interpretation skills and apply this knowledge directly in your clinical practice. Thanks for joining us. Let's get started.
To understand what we are looking at, we need to firstly understand what an Oreo cookie looks like. This is a yummy picture of the Oreo cookie. You know, they say twist it, lick it, and dunk it, hey? I'm not sure. Basically, I think everybody knows what an Oreo cookie is, right? So that's an Oreo cookie right there. The important aspect is that it consists of a layer of white cream, which is sandwiched between two dark, supposedly chocolate dips. Now, if you look very carefully, you can see the same configuration here at the front of the heart. Look at that. Can you see it? Black with white in the middle. Boom! Oreo cookie sign.
Oreo cookie sign colleagues, how are you doing this evening? I hope you are well. This is the Chest X-ray Masterclass information session, and I can tell you I am never alone, and I'm with Dr. Ryan Sweepesat. Hey, Brother Ryan, how are you doing this evening? Are you good?
No. I don't recognize who you are. Why are you wearing glasses?
Hey,
You're wearing glasses now.
screen glasses. I'm trying to filter the light. I've been doing a lot of
Mm,
admin work,
yeah,
so I'm trying to to protect my eyes. Usually, when I have some fatigue, you'll see me putting on the glasses. Yeah, so
the
thank you so
glasses.
much, Dr. Ryan, for joining us this evening, colleagues. This is the Chest X-ray Masterclass, and we do the information sessions to engage with you, to give you an opportunity to ask us questions relating to this upcoming important masterclass, which is very valuable because, as you have heard in the intro, we are all using X-rays every single day, and it's important that we master the art of interpreting them so that we minimize any harm to our clients. Now, let me just share a couple of introductory slides just to let you know what exactly we are up to. Um, Let me see if I can do the same for, okay. Give me a few seconds if I can just check if I have the right screen sharing. Let me see. Oh, I'll be able to do it as well for the socials. Those of you who are joining us on the socials, I hope you can see the slides. So yeah, just to emphasize that as a platform, we have a mission which is to improve patient care, and I can tell you, X-rays are such a very valuable tool. Even yesterday, as we were discussing CNS manifestations of HIV, we emphasized why a chest X-ray is one of those important tools, because you may find non-neurological problems which can sort of give you an idea of what's happening in the head, especially in situations where maybe we are a bit cautious about doing certain investigations in that space. Just to say that as a platform, we are a membership-based platform. Please do join us on this journey. Today's event, information sessions are not about CPDs. It's just sharing knowledge for like 30 minutes and helping you, to stay updated in the field. If you are a non-member, visit our website and join us on this journey. Just also to remind you that the diploma preparatory programs are open for registration. On top there, we have the HIV management diploma, we have the internal medicine preparatory program, obstetrics and child health. So I think we're starting to have a choice, helping you to have choice by giving you a variety of programs which you can commit to depending on your career trajectory and your needs. We also have the diploma in anesthesiology preparatory program, which is very, very new. We actually have two instructors in that particular program. And we are also launching the ophthalmology so that you can see properly. And maybe I won't need my glasses anymore. After this diploma, Brother Ryan, I don't know. Before I pass, let me find the link.
Me too. Me too.
You too. Awesome. So I'm just sharing the link to the page that has all the diploma preparatory programs which we offer for coaching. If you are interested to explore any of those, just visit that particular link which I've just shared in the chat. Just to say that we now have 10 more micro lessons which you can explore, mainly available to our members. We are growing as well our e-learning platform. We have the dispensing course. We now have a monitoring and evaluation course, and we are going to be launching the HIV testing and counseling course aligned with the updated guidelines, which requires us to test and diagnose HIV using 3 tests. So we will do an information session so that you can know why you must do that particular course. And if you are in Durban on the 25th of October, we are going to be palpating and fine needling whatever we can fine needle. So don't miss out on this awesome program. We're going to finish this month looking at alopecia or hair loss. I still have some hair, so I don't think I fall into that category. But today is today. Tonight is tonight. This coming weekend is the upcoming weekend. Don't miss the opportunity to master the art on interpretation of chest x-ray. I'm actually running a poll. I know in the other groups I just posted it as is and people are responding, but in the members groups, you would have assessed yourself, colleagues, in terms of how confident or competent you feel about interpreting lateral chest x-ray, and you would have seen the results that most of us are not very, very comfortable doing that. So here's a program which, if you can start looking at joining us this Saturday, it can really help you in terms of improving your clinical skills. So let me hand over to Brother Ryan to then share what is it that you can expect, and then we take it from there. Thanks, brother.
Thank you, Brother Mabela. Good evening, everybody. Hope everybody's good. Thanks for taking the time. Thank you, brother. Thanks for taking the time to join us on a beautiful, Wednesday. It's a Wednesday afternoon, and we're talking about something we're very excited about, this Saturday's upcoming Chest X-ray Masterclass. So let's dig into it, guys. We're going to cover a lot about chest X-rays, okay? Chest X-ray is not something new for us. We use it a lot. Some of the reasons we use chest X-rays day to day is to evaluate symptoms. So when your patient comes in with shortness of breath and chest pain and cough and hemoptysis and fever and unexplained weight loss, etc., right? Sometimes we use it to evaluate physical signs like the patient's hypoxic or has any abnormal findings on chest exam. Sometimes we use it to evaluate placement of central lines, nasogastric tubes, and even endotracheal tubes for those of us who work in the ICU space. Sometimes to screen for a complication like a pneumothorax or something which may have arisen as a result of some intervention on our part. And then less likely stuff like pacemaker lead fracture and that, okay? And when we cover pulmonology in the diploma program, we look at the 6 stereotypes of lung disease. That's consolidation, effusion, fibrosis, cavitation, suppuration, and atelectasis. You can also include hyperinflation there, right? And these are the 6 cardinal kind of exam scenarios that they like to put in the exam. And we're going to go through each one of them and their features radiologically speaking. What's the course structure? Well, we're going to cover a lot of information from introduction and physics. Now, don't let physics scare you off. It's important for us to understand how X-rays are done in order to be foundational for our understanding in terms of interpreting the films themselves. I have a lot of pretty pictures in there. I'm making it as engaging as I can. So, yeah, don't let physics scare you away. Then we're going to cover a systematic approach at anatomy, how to assess the technical quality of a film. Is it adequate or is it inadequate? We're going to look at that. Then we're going to break into specific kind of sections, looking at airway, bones, and soft tissues, then the cardiac silhouette and mediastinum, then diaphragm and pleura, and then 2 very specific, the lungs in terms of diffuse lung processes, and then focal lung processes, right? Then we're going to talk about lines, tubes, and devices. And lastly, we're going to kind of consolidate everything in terms of a self-assessment quiz with accompanying clinical vignettes. And of course, I love my dad jokes. So, who decided to call it a dental X-ray and not a toothpick? Because it is a pick of the teeth, right? So toothpick. And some people talk about photobombing in radiology. And here's an example of photobombing a chest X-ray. Okay, and so we can get into pathology of some conditions on the X-ray, and probably none of this typifies it more than the COPD, which is chronic obstructive lung disease. And this is an example of how we're going to go into it, looking at the features, right? So obviously with COPD, you have hypoxemia, you have shunting of blood, and you have pulmonary hypertension. So this is one of the signs of pulmonary hypertension with hilar enlargement. Hyperinflation, what does that mean? More than 7 anterior ribs, more than 10 posterior ribs. That's hyperinflation. Look at that. That's on the PA film. Then on the lateral film, we have increased size of the retrosternal airspace, very important. We have increased anterior-posterior diameter, which is what we call the barrel-shaped chest. And we have the diaphragms being pushed down, flattened hemidiaphragm. Okay, then for an example of mediastinal masses, we break it down anatomically and this based off the lateral X-ray, right? Whether it's anterior or superior, because these pathologies tend to stick together, and then whether it's middle and posterior. And then we break down each of these a little. This is an example of the section looking at cavitation. So typical examples of cavitation that we have, this is pneumonia, run-of-the-mill pneumonia. This is a cavity with an air fluid level. And this patient often comes in with halitosis and clubbing, and that's going to be lung abscess, right? It's an example of suppurative lung disease. TB, 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 T to the B, T to the B. Pulmonary metastasis, this time from a squamous cell carcinoma. This is an example of multiple septic pulmonary emboli in a patient who has right-sided infective endocarditis. This is pulmonary infarct. This is GPA, granulomatosis with polyangiitis, previously called Wegener's granulomatosis. This is an example of numerous rheumatoid nodules in the lung in a patient with seropositive rheumatoid arthritis. This is an example of pneumatocele. Okay, I'm just giving you guys examples of how we go through these pathologies. And this is a classic example of one of the self-assessment vignettes. So we can just run through this quickly. 25-year-old man with HIV presents with intermittent fever and weight loss over the last 6 weeks. On examination, you find him to be cachectic, generally unwell. He's pyrexial. His heart rate is 85. That's not too bad. Blood pressure looks good. He's slightly tachypneic at 24 beats per minute with a room air oxygen saturation of 93%. But when you listen to his chest, oh man, you've got diffuse, mild crackles bilaterally. And his heart is a regular rhythm with no murmurs. And this is his X-ray. Okay, and then the question goes on. And we break this down based on what we cover in the course content. So I call upon a table that we would have covered when we looked at interstitial opacities and the breakdown. And we break down nodules, right, into small and large nodules, okay? And we find that miliary tuberculosis is what we're looking at. You can see this very fine millet seed appearance. And then we put everything together. So our primary findings on this, how would you report this X-ray? you'd say this diffuse interstitial opacity is predominantly micronodular, worse on the right than on the left, as you guys can appreciate. And our clinical impression is possible miliary TB, but you cannot rule out fungal infection, especially those with the lower CD4 counts, depending on where you're from and environmental exposure. So that's basically, we're going to cover a whole lot of cases where we're going to put the picture together with the clinical scenario and give you our impressions and thoughts about each case. Okay, Brother Moella, that was my side. Over to you.
Awesome, 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 awesome. Colleagues, how are you feeling? How are you doing? Are you ready? Let me play a short clip before I show you how to navigate our website. Before I show you how to navigate the website, the team, they're always trying new things. It's nice working with younger people. We, the 50-year-olds, hey, can't do these things.
Welcome to the Chest X-ray Interpretation Masterclass, a physician's perspective information session. If you've ever found yourself looking at a chest X-ray and second-guessing your interpretation, you're not alone. Despite being one of the most commonly ordered imaging studies, many clinicians lack confidence in reading them. This session is designed to give you a structured, practical approach to chest X-ray interpretation, from assessing image quality to systematically reviewing PA and lateral views and identifying key pathologies like airspace disease, interstitial patterns, bronchiectasis, cardiac failure, and pleural disease. Let's explore how you can sharpen your interpretation skills and apply this knowledge directly in your clinical practice. Thanks for joining us. Let's get started.
To understand what we are looking at, we need to firstly understand what an audio cookie looks like. This is a yummy picture of the audio cookie. They say twist it, lick it, and dunk it, hey? I'm not sure. Basically, I think everybody knows what an audio cookie is, right? So that's an audio cookie right there. The important aspect is that it consists of a layer of white cream, which is sandwiched between two dark, supposedly chocolate dips. Now, if you look very carefully, you can see the same configuration here at the front of the heart. Look at that. Can you see it? Black with white in the middle. Boom, Oreo cookie sign.
Dick it, dunk it, lick it. I don't know. But if you want to know more about dunk it, lick it, twist it, whatever the sequence is, make sure that you make sure that you don't miss. Look at Brother Ryan there, literally laughing at me.
Yummy.
What is the sequence, Ryan? Dunk it, lick it, twist it.
No, you twist it,
Twist it.
then you lick it, then you dunk it.
You dunk it first. Oh, you dunk it after licking. Ooh, that's the opposite of what we, the oldies, would have done. All right, colleagues, let me take you through the website. So basically, to get to the registration page, you just type in our website there, www.clinicalcareplatform.com. I hope you can see it. It should take you to our home page. But the same registration information can be found on this tab, written workshops there on our menu. But on the home page, we are on the home page, the first tab there. If you scroll down, you'll find a number of coming events, the diplomas, but you can see that the first one you see there is the chest X-ray interpretation masterclass. And what you would love to do is to learn more about this program. So you're gonna click on that particular button. My network is good today. Usually it takes a couple of minutes. Then you get to the information page about the course. You can read what we are going to cover. You can read about Dr. Ryan. You can also listen to a snippet of him teaching about chest X-rays and the key areas that we are going to be focusing on, etc., etc. And and then to read some feedback from colleagues who have used our platform before. If you are interested to pay, you then say, I want to register today. So you click that green button. It will take you to this page which requires minimum information. We don't want your address and where you stay, just your name, surname, email address, and phone number. You have an option to register for the last masterclass for the month, which is going to be on dermatology, particularly alopecia. If you register for two programs at the same time, you will automatically save 100 rand. So if I click on that square, there's a square there. If I click on it, you would see that there's two master classes added, and you have saved 100 rands. If you are a member of the platform, you can click on these words here. Do you have a coupon? You can say, yes, I'm a paid up member. You use capital letters, you type member 25, no spaces before or after or in between capital letters and the numbers 25. You say apply. As soon as you apply that, you're gonna save 10% of the total cost. So you've got savings on savings. If you are also staying outside South Africa and maybe you are not able to transact in rands, you can actually just change there that arrow and say, let me use US dollars, and the system will then allow you to process your payment using dollars, so that you can then transact. So we know we've got so many people who join our programs from outside the country. We still have 2 days, so registration will close just before the workshop starts. So please do join us, or if you have made up your mind to join us, don't delay any further. All right. So yeah, so just to again really thank you for joining us this evening and making time, to be with us. Let me see if there's a way for me to get Brother Ryan on screen. Please feel free to share any questions you might have, because we are about to finish, and we will then go through some of your questions. Maybe Brother Ryan, who can benefit from this program? Do we have a specific target audience who can benefit from the masterclass?
Mm, Anybody, anybody involved with chest X-ray
Yeah,
interpretation, right?
yeah.
So that includes medical officers, intern doctors, ComServe doctors, registrars, specialists, physician assistants,
Hmm,
okay, nursing staff,
hmm.
paramedics, anybody who's involved with chest X-rays. This is for you, and especially you.
Awesome, awesome. Yeah, maybe administratively on my side, one of the common questions, actually, even today, I got an email or WhatsApp. Someone says, I'm not available this coming weekend. Can I still register and complete it thereafter? The answer is yes, but you have to pay and register before the date of the masterclass, and then we will give you access to the self-paced version of the course, right? The same applies to any person who registers and attends. Even if you attend successfully, we will give you access to the self-paced version so that you can rewind, pause, fast forward. If you need to revise a specific section, you can go through it. And if you have not attended adequately in the live version for you to get your CPDs, you can actually complete it self-paced. If you meet all the requirements, you would still get your credential, and we are able to report your CPDs to the professional council. Brother Ryan, can you imagine life without chest X-rays? How would your work be as a physician if we had no chest X-rays? Like, can you imagine it?
Mm. Yeah, I can imagine it, but it is not easy.
Yeah.
We need the chest X-rays, brother.
Yeah, yeah,
Hmm.
yeah. We need chest X-rays, and when we have them, we need to master the art of interpreting these. Um, 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 I'm lazy to mispronounce your name. Should I say Sibyl or Sybil? Mulindi. I think your surname is easier, Mulindi. But the question is about pediatric chest X-rays. Are they included? I'm gonna ask Dr. Ryan to answer, because I think it's a simple answer, but I'm gonna tell you what is likely to come up ahead. Yeah.
Mm. Dr. Mulindi, I'm so sorry. This is for adults.
Yeah.
So I'm a physician, so I like big people.
Mm. Yeah.
Yeah, unfortunately, pediatric X-rays are not included here.
Yeah.
Yeah.
Yeah, so we have Prof. Nazrin Mohammed from VETS. She's actually the head of radiology there at VETS. In the diploma child health, she covers pediatric radiology in one of the sessions. But we are going to have a master class. We are just about to finalize dates. Actually, it was supposed to be in October, but I think she's flying out and there's many other things, but it's coming, the pediatric version. But it won't necessarily be chest x-rays only. It's likely to cover a number of radiology services and common ways in terms of your approach to interpreting those. So you can be assured that by God's grace, before the year ends, otherwise it will be early in the year. But there's a lot of work that we are doing behind the scenes. So very, very important. Brother Ryan, I'm sure you saw the poll. I asked so many. I posted it everywhere, and in our members, it's actually the actual poll. And actually, let me get into my phone and we have now 3 groups because those groups are full. And people are still responding. I wish I could show you. It's 1847, and in all the groups, we have people responding. But in the main group, the first group, there was a question: how confident are you in interpreting lateral chest X-rays? Very confident. We only have about 3 people, and then somewhat, which is B, which means I'm a little bit confident but could improve. There's like 19 people. I'm not very confident. I need more training is 23. And D, I avoid them. If where possible, I'll avoid the lateral chest X-ray. We've got 8. But in the other groups, it's like the same kind of results. Why are we not very confident in lateral X-rays, and how can this program make me a bit more confident? Yeah.
Yeah, so lateral X-rays is like one of those extra tests where we're not really sure when is the lateral helpful, under what circumstance, what's the indications, and when we do have the film in front of us, we're not really sure what we're looking for or how to approach it.
Hmm.
So it's one of those kind of gray areas where we're not exactly certain, but hopefully we can learn more about them and become confident after Saturday's masterclass.
Awesome, awesome, colleague. So that is the message, and you saw the cookie sign. Cookie is on a lateral X-ray. Lateral
Twist
X-ray.
it, lick it, and dunk it.
Twist, lick, dunk.
And dunk.
All right. Some of the questions which are common in the administrative phase, people like to ask whether they will get their CPDs if you are non-members. So for paid master classes, whether you're a member or not, it doesn't carry a lot of weight. As long as you have paid, you attend successfully, you will get your CPDs and certificates. And our members can actually join at a rather reasonable discounted fee, which is very, very important. So thanks for all the questions. Brother Ryan, my question to you, we speak about twist, lick it,
Yep.
and dunk it. Your teaching methods are not the orthodox. They're like a novel ways of teaching. There's a lot of humor. There's a lot of analogies with things that we can relate with. How important is this in teaching and helping colleagues to grasp some of the concepts that sometimes are overwhelming. But when I look at that cookie, I'm like, I can see this thing.
Hey, brother. When being a registrar,
Yeah,
I noticed there's a whole lot of theory that you're supposed to know,
yeah.
but unless you make it practical, it doesn't stick.
Mm,
And a wise man once said, only knowledge that you use stick to your mind.
mm,
So my objective, you know, is to make things practical for people. And
mm,
as you understand the why, then you'll understand when and how.
mm.
So that's the purpose of my teaching, to be pragmatic, to bring it down to everyday medicine, and to put a bit of humor in there as well. Never hurts.
Awesome, Brother Ryan. Colleagues, that's it for the night. It's exactly 1:30. We have to close off. I've just shared the link that you can follow, but I've also showed you on the website. Feel free as well to send us an email if you have specific questions about this masterclass. We start exactly 8 o'clock on Saturday. Don't delay your registration. Maybe, Brother Ryan, your closing remarks as I type in the email that colleagues can use to reach us.
Nothing much else, brother. Just to thank you so much for your dedication and commitment together with the CCP, and to thank everybody that's in attendance. I think there's some 57 people who are here. Thank you so much for taking the time for joining us, and I hope that you will decide to join us on Saturday. And I'm praying that you be blessed together with your families, and I hope to see you on Saturday together with Brother Mawela.
Sharp. Colleagues, on that note, see you tomorrow night. We have a pediatric cardiologist and we're discussing big stuff, so don't miss it. Night. Thanks, Brother Ryan. Blessings to you and your family.
Thank you, brother.
Welcome to the Chest X-ray Interpretation Masterclass, a physician's perspective information session. If you've ever found yourself looking at a chest X-ray and second-guessing your interpretation, you're not alone. Despite being one of the most commonly ordered imaging studies, many clinicians lack confidence in reading them. This session is designed to give you a structured, practical approach to chest X-ray interpretation, from assessing image quality to systematically reviewing PA and lateral views and identifying key pathologies like airspace disease, interstitial patterns, bronchiectasis, cardiac failure, and pleural disease. Let's explore how you can sharpen your interpretation skills and apply this knowledge directly in your clinical practice. Thanks for joining us. Let's get started.